This segment is sponsored by St. David's Healthcare. I'm Lauren Petrowski, and on this Wellness Wednesday, we're talking about hip and knee care. We're joined today by Dr. David Michel, orthopedic surgeon with St. David's Healthcare. Thanks so much for being with us. So a lot of people deal with hip or knee pain. How do they know when maybe it's time to consider a joint replacement?
Yeah, we try and treat everybody without surgery initially. There are a lot of different ways, like medications, injections, physical therapy. But whenever those treatments aren't allowing people to do their daily life the way they want, that's usually when we start the discussion about surgery.
Yeah, you want to consider all other options first, because of course some people are very nervous about surgery. What does the process look like?
Yeah, surgery, is a big deal. At St. David's, fortunately, we do a fantastic job. We have a lot of different people that help take care of patients. The good news is that we've changed a lot of things and there's been a lot of progress. So people are up and moving much more quickly. Most patients, in fact, go home the same day. We utilize technology like robotics or others that help us do minimally invasive surgery and get people back to their daily life really very quickly.
Good to know. Let's talk more about that. What makes hip and knee care at St. David's Healthcare unique?
Yeah, St. David's Medical Center is a fantastic institution. They're very highly rated, the #1 large community hospital in the country, and actually ranked in the top 50 for orthopedic care nationwide. We have a multidisciplinary team from physicians, therapists, lots of folks who make sure every aspect of the patient's care is well looked after.
All right, Dr. Michel, thank you so much for joining us today. And for more information about St. David's Healthcare's orthopedic services, you can visit stdavids.com/ortho.